I'm Nerida. I'm one of the digital health officers here at CESPN. There's lots of us, so the members of the digital health team can help you certainly around uploading to AIR, which we're going to talk about a bit of today, or not so much the uploads, but how to view it. But we can do other things as well. So if you need any help with digital health, just email us. That's the email there, digitalhealth@cespan.com.au, or the main number here is 1300 986 991. And I'm joined today by Tram Doe, and Tram is one of the provider adoption leads from the Australian Digital Health Agency. And so I'm going to hand over to Tram, and she's going to help us have a look at the newer look of how the Immunisation View has changed and improved a bit, I guess, in My Health Record, and how you can access this, which is really, really useful in your practice, and hopefully it'll be a very
So welcome everyone. Thank you for coming along on this session on updates to the Immunisation View within My Health Record. And hopefully some of you are already active and regular users of the My Health Record system and have been able to use it to find immunisation information for a lot of your patients. So there have been a number of recent updates to the system to make it even easier now for you to find and view the immunisation information. And this is particularly relevant now with the current COVID-19 vaccination rollout, as well as coming into the flu season. So in terms of the agenda for today, I will demonstrate the different ways in which you can access immunisation information within My Health Record. So firstly, via the Medicare Overview, which most of you would probably already be familiar with. And then I'll show you the new immunisation consolidated view as well. So what functions are available in that, how it differs to the Medicare Overview. We'll also discuss how you can use this information as well as other documents within the My Health Record system to support your practice in administering and providing vaccinations. So just a bit of a background, and just to set the scene a little bit, I'm sure you're all aware of the recent legislative requirements for reporting of vaccinations. So from the 1st of March, it is now mandatory to report all influenza and COVID-19 vaccines to the Australian Immunisation Register. And I believe that this will extend to all other national immunisation program vaccines from the 1st of July. And there is a direct integration between the My Health Record system and the Australian Immunisation Register. And so once the vaccine encounter has been reported and uploaded to AIR, this information will flow through into My Health Record and be available to you. And so what this means with the new mandatory requirements is that you will start to see more immunisation information flowing into My Health Record. Now, previously, the only way in which you could view immunisation information within My Health Record that was coming from AIR was through the Medicare Overview. And so I will just demonstrate now quickly for those of you who aren't familiar how you can access the Medicare Overview. So I believe that majority of attendees are using either Best Practice or Medical Director. And so those are the two softwares that I will use for the demonstrations. But once you're in the actual overview, the look and feel will be the same regardless of which which conformance software you're using. So I've just got the simulated environment for Best Practice up here at the moment. And if your practice is registered and connected to the My Health Record system, then you should be able to directly access your patient's My Health Record from within your conformance software. So in Best Practice, there should be a My Health Record button here, and clicking on that will open up this individual's My Health Record and bring up the document list. So we'll just give that some time to load. Now, depending on which software you use, for some, the default settings might mean that the Medicare overview and the Medicare documents are hidden by default. So you can see on this filter list here that it has been checked to exclude Medicare documents by default. So I will just need to uncheck that and click on update to bring up the Medicare overviews. And there are 2 Medicare overviews that are available. So there's the one for just the past 12 months and the one for all. So I will just bring up the one for all for more comprehensive information. Now, within the Medicare overview, there are a couple of sections. So there's first the prescription information, and then scrolling down is where you would find the vaccination history that's coming directly from the Australian Immunisation Register. So you'll be able to see the details of the vaccine, so the product, the date that it was administered, and also the dose. So that was in best practice. I will now switch over to medical director. So I'm in the same, I've got the same test patient, Caleb Derrington. And again, if your practice is registered and connected, there should be a My Health Record button or menu. So in medical director, there's a menu option at the top here, and clicking on that will bring up the patient's document list. So just waiting for that to come up. And again, I believe in medical director that a lot of the times the default setting is that the Medicare overview is hidden. And so what you'll need to do is first click on this button here so that you can show the Medicare records, because for some reason it has been hidden by default. And then under the document filter options, you will then need to check the 2 Medicare overviews to say that these are the ones that you do want to bring up. And clicking on OK will then bring up those options, those views. There is also a handy feature with Medical Director where if you right click on the header up there, you can actually save your filter settings. So it will remember that the next time you log in, so you don't have to do that every single time. So that's just a handy tip there for you. Now I will then open up the Medicare overview, and as you can see, the look and feel is very similar to what you saw in best practice. So there's the prescription information up there, and then scrolling down is where you can find the vaccination information that's coming from AIR. And so we have had a lot of feedback to say that although this information is really useful and it's quite great to be able to access this information here as an alternative way rather than having to go through PROTA and HPOS to access this, that although it is useful, it can sometimes be a little bit hard to find in the My Health record. So firstly, just from the name of the Medicare overview, it's not very intuitive or obvious that this is where you go to find the immunization information from AIR. And as you saw from accessing the Medicare overviews in best practice and medical director, that depending on what the default settings and filter settings are, that the Medicare overview can be hidden sometimes and not come up immediately. And so some users might not even be aware that this is something that's available. And it's also not a dedicated view for just immunization information. So, I mean, all of this information here is definitely great and useful, but if you were just after immunization information, then you can imagine if there was a lot of, say, prescription information here, it does mean that you have to scroll down a fair bit before you do get to the desired information. And finally, the information within the Medicare overview is only just that's coming from the Australian Immunisation Register. And so if there was any immunisation information that was uploaded as a My Health Record document in, say, an event summary or a shared health summary, that information will not be available in this view here. You can certainly view the individual documents within My Health Record, but it does just mean that you do need to switch back and forth between the different documents and views. And so there has been a fair bit of work done to try to improve, address these limitations and enhance the My Health Record system's use and display of immunisation information. And so there has been a new consolidated immunisation view that has been developed and released through to the National Provider Portal and the National Consumer Portal. And more recently, in late April, that new view has also been introduced to a number of conformance software. And so what this does is it increases the visibility of immunisation information within My Health Record, which will in turn just help you to be able to use and view and access this information. And it's including the COVID-19 vaccinations, which would be very relevant now. So just to note that within the conformance software, this is an additional functionality. So the Medicare Overview and the information within that Medicare Overview is still there and available. It's hasn't been changed or deleted, but this is now an additional functionality on top of that. So let's have a look at what this new view looks like. Unfortunately, our simulated environment is not ready in time for me to demonstrate this live, but I do have screenshots of what this would look like if you were to access it in your system. Particularly for best practice and medical director. So for medical director, I've got here a similar document list to what you would have seen earlier, and the new view should come up as a under immunization consolidated view here, and I believe it should come up immediately without you having to make any changes to the filter options. And this is a dynamic view, so it does get updated as more information flows through. It also is refreshed every time you open the patient's record, and so the date should always be today's date. And in Medical Director, again, in the document list, it should come up there as Immunisation Consolidated View within the document list. So when we double click to bring up the actual view, this is what it looks like, and it should have the same look and feel regardless of which conformance software you're using, whether that be Medical Director, Best Practice, Genie. It should have the same look and feel. And so within this new view, you can see that it is dedicated to just immunization information, and it does have a couple of additional features and enhancements over the Medicare Overview. So the first section is the status. So you can see, which is for both the immunizations under the National Immunization Program as well as the COVID-19 vaccines. So you can have a look to check whether or not the individual is up to date with their immunizations. And this is based on what's recorded in the Australian Immunisation Register. There's also a section on the next immunisation due, so you can see if they have any upcoming vaccines. So for example, if this individual has had their first dose of the COVID-19 vaccine, there should be an entry there where you can check to see when their second dose would be due. If they have any notices recorded in AIR as well, this will also appear here. And then following that would be the immunization history. And like the Medicare Overview, the Immunization Consolidated View will pull through all vaccine records from the Australian Immunisation Register for this individual. But in addition to this, what it will also do is it will be able to pull through immunization information that has been recorded from within My Health Record documents, such as the event summary or the shared health summary. And so at the top here, there's a navigation panel where you can choose the source. So if you wanted just purely information from the Australian Immunisation Register, you can click here, and this is also the default that will come up on the landing page. Or if you would like all immunisation information available within the My Health Record system coming from both AIR and the other documents, you can use this section here. And there are also shortcuts to the most recent shared health summary. So the hyperlink there will take you to the most recent one. And then if there are any, the most recent event summary, if with any immunisation information as well. So let's now have a look at the information in these two sections in a bit more detail. So firstly, the ones from just the Australian Immunisation Register. So that section is down at the bottom here. So the details that are available to you would be the source, where it's come from, the date of administration, the dose, the vaccine product or the brand, as well as the disease or the indication for that vaccine product. And so just a little bit more details than what you saw in the Medicare overview. And by default, the entries are sorted by date. So the most recent vaccine encounter will appear at the top. And I believe there is ongoing work as well to continually update and enhance the information within this view. And so in future, you might also be able to see the batch details or the expiry of the vaccine product. Now, moving on to the next section, if you wanted to view all information, so both AIR and the My Health Record documents, this is what it might look like for one of your patients. So again, the same heading and details as you saw in the other section. So we've got the source here, so it's either coming from the Australian Immunisation Register or documents within the My Health Record system. And where the source is a document in the My Health Record system, it actually links through to the source document. So you can actually click on the hyperlink there, and it will open up the source document where you can view the vaccine or this entry in more details. So you can have a look to see which organization or which provider administered the vaccination, as well as any notes that they have recorded that are relevant to this encounter. And so the advantage of this section is that it does help to capture any missing information. So if, for example, some reason the vaccine record wasn't uploaded into AIR, you would be able, it would capture this information if it was available in the My Health Record system. And this may not be so much of an issue going forward with the new mandatory legislative requirements, but it could be rather important for those historical vaccine encounters. And in addition to that, these documents might contain additional information that's not available in the AIR entry. So for example, there might be more detailed information if, say, the patient had an adverse reaction to the vaccine that was administered, or if the vaccine was given very early or very late. There might be details in the event summary there on the reasons behind that that you might want to refer to. Now, I do want to point out that when you are interpreting the information within this view, then to be quite mindful that it does mean that there may be some duplication of information. So if the vaccine encounter was reported and uploaded to the Australian Immunisation Register, and it was also uploaded as part of a shared health summary, for example, that it could mean that there are two entries in this list. So just be a bit mindful of that when you do interpret the information here. However, it should be relatively obvious from the date and the details of the vaccine that they are referring to the same encounter. So just as a bit of a recap, there is now a new consolidated immunisation view that is dedicated to just immunisation information. So it is bringing together all of the different sources, both the documents in the My Health Record system and the Australian Immunisation Register, and putting that all into one consolidated view for you so that you do have that you can view this information at a glance. And there are additional information as well on being able to tell you what the immunization status is for this individual and whether or not they have any immunizations that are upcoming or if they're overdue for any immunizations. So just helps with your checking, your clinical checks when you're providing vaccinations or just the overall care for this patient. And so I do want to now discuss how you can use the different documents within My Health Record to support your practice in administering vaccines. So on this page here, is a list of the key documents and views that are available within My Health Record. And some of these information can be really useful to support those clinical checks and the pre-vaccination screening that does need to be done before administering a vaccine. I do want to say first up that it is important to keep in mind that the My Health Record system does contain some really useful information, but be aware that it may not contain every piece of information, and so don't treat it as the complete source of truth, but it's certainly a great additional source of information to complement what you already have in your systems. And also particularly for any new patients that you don't have information for, this would be a great starting point as well. So in terms of immunizations and vaccinations, the information in the immunization view would be definitely very handy. If you're administering a COVID-19 vaccine, for example, you can have a look at the immunization history to see if the patient has had a recent flu vaccine and whether or not it would be appropriate to proceed. If they're coming in for their second dose of the COVID vaccination, you can have a look to check what brand they received the first time and also the date that the first dose was administered so that you can ensure that the appropriate dose interval has elapsed. And in terms of the pre-clinical checks and the pre-vaccination screening, information in the medicines information view would be really useful. So there's an allergies and adverse reactions section there where it's pulling out relevant information from all of the different documents within My Health Record and putting it into one consolidated view for you. So you can have a look at this section here to see if this individual has had any anaphylaxis or adverse reactions to any previous vaccines. And you can also have a look at the medicines preview section to see if they are on any medications that might be of concern. So for example, if they're on any anticoagulants or any immunosuppressive therapy. And it also links through to the most recent shared health summary and the most recent discharge summary so that if there was any new or unfamiliar patients, you can definitely have a look at these documents to help you gain a better understanding of their overall clinical picture. And if your practice was administering COVID-19 vaccinations, then for those patients in phase 1B, you do need to check for their eligibility. Now, for your regular patients, you probably already have this information in your software. But if you are getting a lot of patients that are new and unfamiliar to you, you can certainly have a look at documents like a shared health summary or a discharge summary, and that will provide you with information on what their medical conditions are. You can also have a look at prescription or dispense records to see if they're on any medications that are related to the medical conditions that would be eligible. And these can all be used as proof and evidence of eligibility for the COVID-19 vaccinations. And even if you're not participating and you're not actively administering any COVID COVID-19 vaccines, if you had a patient ask you, you can use this information to help determine whether or not they are eligible. And what you can do is you can print out a copy of the relevant document to give to the patient that they can then take with them to their vaccine appointment. Or alternatively, you can advise them of how they can go into their own My Health record to access this information. And something else that you can do as well is check the Shared Health Summary for your regular patients to make sure that they are accurate and up to date. And now would be a great time to upload a new one for any relevant patients. So that does take us to the conclusion of this presentation. I hope that that did give you a good overview of the new Immunisation View, and I would encourage you to start using that for your patients wherever relevant. So I will now open up for any questions that you might have.
Okay, so we do have one straight away. Thank you, Tram, and thank you for that presentation. I enjoyed it because I think it definitely looks like an improvement on the way the immunisation information can be viewed. So the first question that we have been asked is, does the patient get notified that you're accessing their My Health record?
Yes, they can be notified. So within their own My Health record, patients have the option to register for notifications. So if an organization, a new organization, accesses their My Health record for the first time, they can receive, say, an SMS alert. So yes, they can be.
So that obviously that depends on their preference. So
Yes.
yeah, so I mean, I have that set in mind. So if like a pharmacy looks at it, I actually get an email to say that this pharmacy has looked at your My Health record. But yeah, that will depend on the individual's notifications. They will, of course, be able to see it. If they look at their own My Health record, you can see who's viewed your My Health record.
Yes, that's right. There is an audit trail as well. So you can, so even if they don't get the notifications, they can go in to have a look at that in their own time, and they'll be able to see who has viewed their and access their record. Yeah. Absolutely.
So yes, I will also just say that I know that some of you that are online today are not using Best Practice or Medical Director. And so, as Tram said, the view is largely the same. But if you need any specific assistance around your own software or how to get into this information, just contact myself or the digital health team, and we're more than happy to either talk you through it or come out and show you or anything like that if you're not quite sure.
Yeah, absolutely. And I believe that the agency also has a regular ODT classroom sessions where we do go through all of the different softwares in a simulated environment, and we will be incorporating this new view into those sessions as well. And if you're not using conformance software, there is the National Provider Portal, and the new view is also available within the portal.
Yeah. So I think as Tram's already sort of shown, obviously this is around the viewing of the immunisation record. The actual uploads you still do however you're doing, you know, whether that's through your conformance software or however you may be uploading into AIR itself. But the benefit of this, I think, is just that you don't have to then log into PRODA, log into, you know, to get into the immunisation record through PRODA can be very time consuming, and then it times out, and then it can be difficult. So for example, for pharmacists, you know, they can still upload if they're doing a vaccination through their guild link or however they do it, but just the ability to just press on the button and go straight into the view to have a look and say, oh, hang on, you already had a COVID vaccine only a week ago or whatever. I think that's, yeah, the benefits probably can't be overstated, because it's just so clunky to go into. So I probably shouldn't say that. I can say that. I don't work for the Digital Health Agency. You know, the PRODA, like PRODA is great and it works for a lot of things, but it can be quite difficult to set up and it can be difficult to access. So I think that this is certainly very beneficial.
Yeah, exactly. Being able to access it directly within the patient's record without having to change screens or log out will definitely save time. And just having all of that information in one consolidated view, so you can see it at a glance, or what you need, is really handy.
Yeah, and of course now because it is mandatory, you know, that stuff is going to be there. It's not just in the GP software in their practice, it's going to be there in the immunisation register, whether they've had flu vax or they've had COVID vaccines. And then as we go forward, any of the immunisation program vaccines are going to have to be in there. So just feel free to contact us at the Digital Health Agent, Assessment, Central Eastern Sydney, PHN. And we're more than happy to help out with any of the questions you might have around this. So we're just record immunisations done overseas on best practice and then upload a shared health summary on My Health Record. Will those immunisations be linked and uploaded to AIR automatically?
Within My Health Record, it won't be able to. I think the integration to AIR is quite one way, in that the My Health Record receives information from AIR, but it doesn't actually upload anything to AIR. So it would be dependent on whether or not your best practice, if that program is able to upload that particular overseas record to AIR. If it does get into AIR, then it can flow through to My Health Record, but it's not the other way around.
But presumably, if they put in a shared health summary, it would be in the view. Would that be right or not? Is that not right?
Yes, it will.
So it wouldn't be in AIR, but it'd be in the My Health
come
Record
up,
view.
yes, as one of these My Health Record documents. Yes.
Okay, perfect. Lovely. So I think without any other questions coming, that will probably be everything from us. So thanks again to Tram. Thank you everyone for joining us on your lunch break. We appreciate it, or hopefully you get a lunch break. And yeah, like I said, contact us if you've got any other questions. This has all been recorded. It'll be up on the YouTube channel shortly, well, within a few days. And thank you again.
Thank you.